Are you a manual therapist ready to expand your clinical reach and deepen your effectiveness? Upledger Craniosacral Therapy addresses deep restrictions, supports neurological and fascial systems, and enhances whole body function by working with the body's natural healing processes. For over 40 years, Upledger Institute International has led the field of craniosacral therapy, offering an approach that integrates seamlessly into any manual therapy practice and supports common to complex and chronic conditions. Find a class near you at upledger.com/courses or call 800-233-5880 extension 2 and begin your craniosacral therapy training for as little as $100 a month. As a massage therapist, flexibility means more than choosing your days off. It means opportunities to work when it makes sense for your life. Hand and Stone Massage and Facial Spa helps therapists build books that complement their lives, with variable schedules, a built-in member base, and a national footprint. Hand and Stone offers you a model designed to meet therapists where they are and help them get where they want to go. Learn more at handandstonecareers.com.
Dear, I have a client who, listeners, I'm doing something with this episode that I have not done before, which is offering you an interview in 2 parts. I had the remarkable opportunity to interview Dr. Chris Callewaert from Ghent, Belgium, who goes by the name Dr. Armpit. In part 2, Dr. Callewaert will describe his work with the Yanomami tribe of Brazil and some fascinating discoveries that he made about this group of people's experiences with body odor and some other health challenges. And then we will go from there to a more practical application of his discoveries having to do with foot problems, his discoveries having to do with bad foot odor. And we'll conclude this conversation with some ideas about communication skills and how we can compassionately and non-judgmentally share our concerns about someone's health when that becomes an issue in relationship to their body odor. So enjoy this follow-up to part 1 of a conversation with Dr. Armpit.
Now, I've had the chance to visit the Yanomami in the jungle. They do not have body odor, and they have a much more diverse skin microbiome. They have much more diverse gut microbiome, but they live a completely different lifestyle. We cannot go back to the jungle and all live, jump in the water and live in the jungle and live in huts. We cannot go back to that, but we can pick up certain lifestyle habits that they have that we don't have anymore. So basically, they have a very diverse skin microbiome. They also have the typical skin bacteria that we have, but for them, it's much more diverse. So it's much more environmental bacteria that are also living on their skin that actually are protecting them. We saw certain bacteria that are living on their skin that protect them from sun damage. And they never get any skin cancer. So no melanoma, no non-melanoma skin cancers, nothing. They do get blind because there's a lot of sunlight. It's on the equator, but they never have any skin cancer. While for us, if we, and certainly at a young age, if we accumulate that over lifetime, you will develop skin cancer. But we also are way too clean. We clean ourselves too much. We use soaps and detergents, surfactants, but also antibacterial soaps, and they decrease the bacterial load, and basically it influences the skin microbiome towards diversity, which is much lower and much less biologically rich, so to say. We've lost a lot of functions in that microbiome. So the diversity of the skin microbiome, but also the gut microbiome, is super important in order to protect us, in order to maintain a healthy skin barrier, in order to train our immune system as well, to provoke certain antibacterial compounds. Our keratinocytes produce also actively antimicrobial peptides that keep the skin microbiome in balance. So basically, there's a multitude of different functions that the skin microbiome have that keep our skin healthy and intact.
Thank you. This is so important for massage therapists to understand. I'd like to talk a little bit about the work that you've been doing at your lab. And to do that, I'd like to try to reframe what I've understood from going to your website and following what you've been putting on threads and so on, to see if I've got this correctly. So one of the approaches that you look at least, is that someone with persistent bad body odor needs to replace or rebalance the microbiome in their armpit. And there are varieties of ways to do that, including what sounded to me like an application, like a topical medicine. It sounded almost like a bacterial transplant, like people do sometimes to restore their gut microbiome. Did I interpret that correctly?
That's my invention, essentially. Yeah.
Oh, congratulations.
Well, yeah. It actually, long story. How I got into my PhD, it was essentially an own personal struggle, no personal story.
Mhm.
I never had any body odor. And at some point, I picked it up from this girl that I liked. We spent the night together, and basically, it was day and night difference before and after. It was basically, my body odor completely changed. And that became an own personal struggle. Like, I never had it. I never needed any deodorants. And now I need it on a daily basis. Like, I need to cover things up. And why is that? And the only possible explanation could be that the microbiome in my armpits had changed. And of course, there was a lot of close contact. So that completely made sense. So I knew if it's possible in a bad way, it also has to be possible in a good way. So if you can transfer bad bacteria, you can also definitely transfer the good bacteria. So that was my whole idea that I pitched to several professors. They all found a great idea. That's how I rolled into my PhD. And that's how we started with doing armpit microbiome transplants, which transplanted non-smelly armpit bacteria to people suffering from it, which resolved body odor, but was quite tedious. And then later on, we basically isolated the good bacteria, the good species, put it into some sprayed application so they could use it on a daily basis. And that called bacteriotherapy. And that also very nicely shifts the microbiome toward a better microbiome and basically resolves body odor from the get-go, from at the source, essentially. Because the source, like sterile sweat, normally does not smell. It's really the bacteria that live there that munch on it and leave smaller and more volatile compounds behind. And it's really the bacteria that determine whether there's body odor, whether the odor is good or bad.
Okay. The place that I get a little bit confused then is that we just spent several minutes talking about how body odor is, if you like, a reflection of what's happening in the gut. So this topical application, I'm assuming, doesn't have a reverse influence on the skin gut axis. Have you done anything? Do you have any ideas about what the duration of effect is for your spray-on application? And how does that connect to what's happening inside?
Several months or even permanent. Several months or even permanent. So this in the gut we have 100 trillion bacteria.
Yeah,
which is a lot. And on the skin we have 1 trillion bacteria, so 100-fold less. Mm-hmm. The bacteria the good bacteria can also influence the immune system in a positive way. So you feel better and you feel. It can actually also have from skin also an impact on our brain or our own body. But we have much more bacteria in our gut to have an impact, and we don't feel it there. So they really impact. If there's something wrong in the gut, it really impacts on the outside as well. There's 2 reasons for body odor. One being it's the bacteria, and the second being it's the sweat. If the gut is not okay, the sweat will be impacted. Right? Then the sweat, you will produce more apocrine sweat. There will be more different molecules present there, and cues for health, cues for reproduction, cues for stress, cues for whatever. But then you still have the bacteria, and they still convert those molecules into smaller molecules and then have an odor. So it's 2 important things. It's the bacteria and it's the sweat. And they really, they feed into each other as well. So if you produce more lipid molecules, you will have more lipophilic bacteria present there. But our topical idea is then, okay, you can take those lipophilic bacteria away, put better bacteria away there. They will still feed on the lipids, but they will not convert it into smelling compounds. So it's ideally you change the microbiome, but you also change the sweat. So you also treat the problem from within, but it can be really many different things.
It sounds like your application is going to be really helpful for some people, but if they are still very disrupted internally, it's not a permanent solution.
It depends from person to person how long it lasts. Essentially, there's been many people that have been using it, and they say, "Yeah, I don't need it anymore.
That's
All the
amazing.
better. I'm happy. I'm really happy. The goal is the whole body odor is solved for them. Perfect." Other people, they need it more frequently, just to maintain a bit that good microbiome, because internally the flux, the sweat will steer again towards more lipophilic bacteria. That you can't really control that. You can only control it by applying the good bacteria in them.
Right. Well, I mean, you can get at it by addressing whatever is happening in their gut through diet and
absolutely.
other.
That's the ideal
lifestyle changes.
situation, but it doesn't go overnight. It doesn't really resolve by eating your broccolis tonight. It really needs to be.
That creates an entirely different kind of odor. So
So it's you really need to study the whole diet, and then
Right.
also really the gut health. Need to analyze with certain biomarkers, can tell gut permeability, gut inflammation. Analyze what's going on, how thick is the mucus layer, all those things to analyze. How good or how bad is it?
Yeah. Here in the States, we are really coming to understand the problems associated with highly processed foods. So that includes fast food, but also, the boxed dinners that you get from the freezer and things like that, because they're convenient, and eating something is better than not eating, but it carries a cost that goes beyond meeting the immediate need.
For instance, in China, in the last 10, 20 years, they have really caught up with westernization, so to say. And the amount of inflammatory diseases have really also sharply increased,
Right.
almost to the levels of America or other Western countries. I haven't seen any reports on body odor. China's been outside. It's also genetically, if you can genetically determine if you're going to have body odor or not. But I mean, lifestyle and gut health have a big impact on your general health and on certain diseases. And it boils down as well to those processed foods, to the use of surfactants, or the use of antibacterial ingredients, both on the skin and in the diet. It really.
Or people who take, long courses of antibiotics. A couple of years ago, I did a podcast episode on because someone had sent me a question about the smell of a client's feet. And I kind of opened it out to my community and said, have you had issues with the smell of clients' feet? I'm not in practice anymore, so I am no longer dealing with this. But I got lots and lots and lots of feedback about, early identification of diabetes, but other things as well. And I'm wondering if because feet, I believe, are, oh gosh, now I've forgotten, eccrine sweat glands rather than the apocrine glands, right?
Correct.
Good. Thank goodness I got that one right. But can you speak at all about foot odor in relationship to the work that you've been doing?
So the first approval that we got for skin microbiome transplant was both for armpits and for feet. Now the feet, they're really more an outsider on the human body. Every body part has its own skin microbiome. And that's definitely true for the feet as well. On the feet, there's much more fungi and yeast present there. Is much more diversity present there. There's a big impact of the shoes and the socks that we wear. So basically, in underarms, there's normally not a direct contact between shirts but on feet, there's constant contact between either sock or a shoe or a flip flop or the floor. So there's a very close contact between the footwear and the feet. There's a big impact of there's a thick skin as well there. There's deeper pores as well in the feet. It's really a matter of microbiome there as well. The microbiome plays a critical role in odor development. And bottom line, what we learned is if there's no or limited contact with nature, that heavily impacts the skin microbiome on the feet.
Impact with nature. What does that mean?
Can be as simple as walking in the grass, or walking barefoot on the floor, or walking. No, ideally walking in a morning grass in a moist environment, walking in the grass. It's really that's often what I recommend to people with foot malodor. That can be very straightforward, can be actually resolve already the problem. If you wash your feet and just go walk in the grass, you pick up bacteria from the environment. That bacteria become your your foot microbiome, and basically they start to combat each other, and they break the sweat molecules and the keratinocyte and then the skin discolmation. They break it down in a different way, so it doesn't necessarily smell all that sharp and unpleasant. Or for instance, Propionibacteria can produce these specific sharp, sour notes in foot malodor. There's a specific bacteria linked to specific odor molecules. But contact with nature is crucial. We actually also did transplants from one person to the other, and that also magically resolved foot malodor. We haven't done too many of those. We are much more advanced on armpits, of course, but also with on the feet, you can very nicely shift the microbiome towards a better microbiome by transplanting bacteria from one person to the other, and that really magically resolves the foot malodor as well.
Interesting. I wonder if that would also be protective, or even, possibly a treatment for people who are prone to fungal infections?
Yes, yeah. Fungi and the bacteria, they're all, they're all part of the microbiome.
Yeah.
And if there's too much way given to candida or to, it's really, if you instead feed, if you have the bacteria there that feed off of whatever is present there as food for the microbes, then there's less food and nutrition left for the fungi. So that really is a convenient solution. And
Well, now I'm envisioning a massage therapist who keeps a little walking tray of fresh grass for their clients to walk in a little bit.
Soil,
before they get dressed.
Yeah.
It would be an interesting extra service to add. All right, this has been wonderful, but I'd love for you to talk a little bit about something that you began with, which is that body odor affects quality of life, right? And people's self-esteem. And it can be really hard to hear that you have, unpleasant body odor. Or once I had someone tell me I had bad breath, and they did it in the most compassionate, useful way possible. And still it was devastating, right?
Yeah.
Can you talk a little bit about what, this may or may not fall into your skill sets or the things that you need, but when you are communicating with people who you are working with about their skin health, can you talk a little bit about how to communicate with clarity and compassion about what you are experiencing, and you're, with concern on their behalf?
So body odor is a taboo topic, and it's definitely taboo for colleagues, for strangers, for people in professional environments. But it's less of a taboo for your close friends and for family members. So if you have body odor and somebody wants to indicate that that person has body odor, it's best that that comes directly from a very close friend, a family member, or brother, sister, mom, dad, daughter, son, somebody close to them, or basically in a professional environment. You should ask like the best friend of that colleague to bring it up. Then, in most cases, they would already know that they have body odor.
Yeah.
So basically, they have been exploring options already. They've been looking at solutions already, but there simply is none.
Mm-hmm.
So that's quite frustrating to then hear again that they have the problem and they can do nothing about it. They will always suggest, use this deodorant, this works good for me. Use this deodorant, this works good for me. But they probably already used it and it didn't work for them.
Right.
So yeah, that is frustrating if there's a problem and you cannot really fix it. So if you need to communicate that, it could come from somebody close to them. Simply putting a letter on their computer in the evening or in the morning to discover, saying that they have that problem. It's not the most fun moment. I can assure you.
No, it's of course it isn't. And the problem for us is we are not allowed to do that. We can't go to someone else and say, "Hey, listen, could you pass the word that they really need to do something about their body odor?" Because of, client confidentiality. So really it becomes a conversation about, this is a big enough issue that I'm concerned about your health. What would be the next part of that conversation?
I mean, it's best then to have a mutual conversation then, right? Explain their own experience, and then basically, because it still is a loaded. I mean, if that person wants to talk about it, that person will talk about it, and there are many people that can openly talk about their body odor and have no problem with it, and just I have this, yeah, I know, and blah blah blah. And they're quite open to it, but other people is very sensitive, and you need to be very careful not to make the problem bigger as it already is. So it's
right.
Direct not towards them, but towards yourself or towards somebody that you know, to keep it more generalized, so to say. And as such, you give information, and they can do with it what they want.
Right. Yeah. That ultimately that becomes their choice. Well, Dr. Armpit, if people wanted to learn more about your work, or see your TED Talk, or see if they could get access to this product that you've been developing, how could someone find you?
I have a website called drarmpit.com, very original. And we have a spin-off from the university called Biome, with a PH. It stands for Future Biome. So biome.com, and basically there we have the product available, our probiotic deodorant, and also probiotic t-shirts that we make. And our final aim is to solve body odor. I often do consultations as well. Basically, we stand for the fact that we will solve body odor. So that's what we want to do. And of course, we're also active on social media, on Threads, on Instagram, on YouTube, TikTok. I try to share a bit the daily experiences, anecdotes, tips and tricks, and help to lower the taboo topic as well, because it's a loaded topic, and it's even much more taboo in the East than it is here in the West. It's just a very loaded topic. It's good that there's conversation about it as well.
Right. In our field, we find that if we can name the things that we're embarrassed about, it takes a lot of the sting out of it. I have a colleague who posted a big sign in her office saying, "It's not a good massage until somebody farts," and it was
That's a good one.
right, and it makes people less self-conscious about just being a human being, right? So
yeah, absolutely, yeah.
All right. Well, I want to thank you so much for spending some time with me. I'm sure many, many people will be grateful to hear that we are not alone in dealing with this as an issue in our work. And I think your work is so interesting, and I wish you very, very well.
Thank you.
Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.